because I think the segue into this is, I think that a lot of far-sighted employers are starting to also look at how people's work-life balance works. So for the first time last year, we had a hotel that closed their kitchen for 2 nights to give the kitchen crew and the kitchen brigade a break for 2 days. They actually, well, 2 nights, they actually brought in street food. There's the same number of hotels now that are offering chefs at least 2 nights off a week, when it used to only be one whole hotel, where they, it's very, very strange for hoteliers to do this. They have a WhatsApp group of staff, and they contact them on the Wednesday about what shifts they want to do the following week. When they have a gap that needs filling, when they go back and say, well, just volunteer, they just appreciate being asked.
Healthy Cornwall is part and parcel of sort of Cornwall Council wellbeing and public health, but we're the sort of customer facing sort of arm of that, if you like. So I'm going to talk about some of the programs that we do today, and then Sue's going to take over and explain what the training offer is, well, that Healthy Cornwall have got to give you. So first of all, I'm going to talk about the NHS free health checks program. This is for people aged 40 to 74 years. It's free, and in fact all the programs I'm going to be talking about today are free, no charge at all. And when we consider what we've heard so far about the workforces, finances, and one thing and another that we've had been spoken about today, the biggest asset is without doubt the workforce itself. And if you have a healthy workforce, you've got a happy workforce, and a happy workforce is a productive workforce, and everybody's a win-win-win. And that's what we're looking to do, is work with businesses across Cornwall, which we've been doing for a number of years, but also communities as well, and delivering these programs. And what this actually does is make the employee feel valued, because the company has taken the trouble to get some experts in who can provide a service which is in their best interest. So first of all, NHS health checks, 40 to 74 years. You have to be within that age range to be able to qualify. You can't have one of these without a 5-year gap. That is the sort of funding regulation. So if you've had a health check, then you've got to wait 5 years before you can have another one. Obviously 40 plus, no underlying health conditions. There are a number of health conditions here for eligibility that you should be seeing a GP, quite frankly, and therefore you would be excluded from a health check under this condition. So if you've got high cholesterol, the chances are you are seeing a GP on a regular basis and therefore under medication. Health checks are designed to try and catch that cohort of people that don't find time to go to the doctors, work long hours and all the rest of it, farmers, fishermen, people like that. But we serve everybody, and even within businesses who shift workers and stuff like that, their shift patterns don't necessarily line up to go along and see a GP and so forth. So the service we provide is rather good in the sense of being able to access those people and give them the opportunity to have a brief health intervention, which is what this is. And when we do this health intervention, we will go onto site to do this. We will take with us our Tanita body composition scales, and this will give us a detailed printout of how the BMI, the body mass index of the individual, is made up. So they'll learn a lot about themselves here, whereas just standing on the bathroom scales will tell you how heavy you are or how light you are. This will tell you much more. It will tell you how your hydration level is, your bone mass, your muscle mass. It'll look at your fat percentage. It will look at visceral fat around your inner organs. This is all stuff that we can give information on and feed back to the individual. We also talk about cholesterol and actually provide a cholesterol blood test, and the results will be available on the day. We have analyzers that we take with us, and they can produce the results in 10 minutes. So it's rather an amazing piece of kit, really, but it gives people a bit of a heads up, because cholesterol can be something you may not even know you have. It can be hereditary, something that you inherit from your father or your mother, those type of things. And therefore, a test like this is a really useful thing to do, because you can find whether your cholesterol is good or bad or way over, or doing really well on the underside of the scale. So we can explain all of that when we do that test. And we also do blood pressure as well. And blood pressure is, again, something that you won't really know. Even if you've got high blood pressure, there are no symptoms for high blood pressure, but there are symptoms for low blood pressure, such as feeling faint. And if you stand up quickly, you may see stars or feel very dizzy. You don't get nothing with high blood pressure. My mother used to quote to me, "That man's got a very red face. He must have extremely high blood pressure." Nothing to do with it. He's just probably warm. But but that's the two differences, really. And we have, been doing the job a while, and we've come across some people who didn't know they had blood pressure. In fact, I had one lady who I recommended she go straight to the GP after the appointment and make an appointment, because her blood pressure was 230 over 120. And that, when you consider the norm is 120 over 80, is considerably high, and the risk of stroke or heart attack going around with that is pretty high in the percentage bracket. So it can be an early warning device, is the point I'm really trying to make. Okay, so what else do? We look at exercise, we look at diet, we look at smoking and alcohol, and we give advice based on the sort of nice guidelines as to where you should be with your sort of consumption, or just commend you on how you're doing. If you're doing really well, you want to give up smoking, we can refer you across to another Healthy Cornwall service, which is the Stop Smoking service, so we can help you with that one. At the end of our sort of NHS health check, we then put the results in that we've attained from you during the course of the process. And that will go into a thing called a Q-Risk 2 program. Quantifiable risk is what the Q stands for. And that will give an assessment based on your results over the next 10 years. That's a projection, really, of your risk of stroke, heart attack, chronic kidney disease, and things like that. So you will have a bit of a heads up. So if you keep your lifestyle the way it is, it might not be a good idea. But if it's a really healthy lifestyle, then stick with it, because it's going to really minimize your chances of having something rather, sort of unfortunate later on in life. It takes us about 30 to 35 minutes to perform a health check. And when we talk to people, or the health and wellbeing representative of an organization, we can arrange everything that we need to arrange with them. And I will be able to provide a sort of like a leaflet handout poster type thing with all the information about the eligibility and what we cover. That can be, I can do that through my email address, which I know you and Charlotte got. So that's health checks in a bit of a nutshell. I'd like to move on to health assessments now, and health assessments are aimed for that group of people under 40. This is for 39 to as low as 16. And with health assessments, there is no eligibility here. You can just turn up and have one. It's not a problem. We don't contact the GP like we do with the NHS one. The NHS one, we're bound to sort of update your medical records with the findings that we make. With this one, it's not the case. This is just a heads up, really, on how well a person's health and well-being is doing. And we look at, on this one, we look at BMI. Again, we weigh them on our Tanita scales. We look at blood pressure. We don't do the cholesterol test because that's funded for the NHS only. So on this one, we can't do that. But we can, for the 25 to 84 age range, do the quantifiable risk. So we can look at that together there on that one. And that sometimes appeases the younger ones in an organization, that they get something as well as the older ones get the opportunity to have something as well. So that's our health assessment program. And then we've got our digital service. This is the virtual lifestyle assessment, a VLA, as we call them. Charlotte, I want to get you on one of these before the time is up here, so you can talk from your own experiences. That would be really good. But what a VLA is basically a virtual lifestyle assessment. It's as simple as that. And we use the MS Teams program here to sort of do exactly what we're doing today, but on the MS Teams. And what we look at on this one is something that we don't look at on the other two programs, and that's mental health. We do a mental health screening because this program was born out of when the pandemic started, really, because we weren't able to do face-to-face working for obvious reasons. So we needed a program that we could offer as an alternative service that would allow people to have a comprehensive health intervention, but without the face-to-face impeachment, if you like. So on the VLA, we can't do obviously standing on our BMI scales, but what we can do is calculate on our Healthy Cornwall online BMI calculator what your BMI would be. We can also talk about other aspects here. We look at alcohol, we again look at exercise, we look at hydration, and we also look at the stop smoking aspect if that person is a smoker. But let me leave the lifestyle because I've talked about that in previous programs. So let's go over to the mental health screening one now. This was devised by a principal practitioner and Dr. Richard Sharp at Cornwall Council and myself. And we wanted to try and have a mental health assessment which wasn't too, I can say, intrusive, not too intrusive, but enough for us to gauge whether that person needed some support. And we can then signpost that support to some of the many growing number of health organizations now that are offering support in this area across the mental health spectrum. So we devised a questionnaire which we can send out to the person, they complete it, and then when we get it back, we evaluate using what we talked about this morning already, which is work-life balance. So often the two go hand in hand. If life at home isn't very good, it can affect work, and if work is stressful, it can affect life at home. So we never really pull them apart. We try to keep them separate, but they have their own impact on each other. So we look at that, and then we discuss together based on our experiences as health workers. But where it gets beyond us and we know where those lines are drawn, we then refer on to somebody of a further level of expertise who could then support the individual. The other good thing about the VLA program is the fact that we have an 8-week follow-up. So if we do decide to set some SMART goals or make some professional signposting to them, we can then touch base again at that 8-week point after the first assessment and see how they're doing, see what progress is making. And I'm proud to say that in, well, 92% of the cases that we've had, everybody is making, to some lesser or greater degree, progress. And that's great because we want the program, and it is actually turning out to be a platform for change. And that's what we wanted to do from the offset, really. So the VLA program has proved extremely valuable, especially when we were in the height of the pandemic, and I was speaking to an awful lot of very tearful mums who were trying to do home education, look after the children, and the husband was working in the front room, and they were trying to do a job as well. And the dog was barking, you know, so it was all these things. It was some really pressurized moments there. So the VLA program has really sort of come into its own. Because of its versatility and its carbon footprint benefit, we are keeping that program, and we use it now as one of our 3 that we offer out. So we got the health checks, 40 to 74, we got the health assessments, 39 and lower, and we've got the virtual lifestyle assessment, which actually doesn't even have an age group. It doesn't have any eligibility. You don't need to have any underlying health conditions to be worried about. You can have one of these once a year, you know, without intrusion. And the results are private between the practitioner and the individual and not sent to the GP, because this is a standalone program. So those are the 3 programs that Sue and myself deliver to businesses across the county. And if need be, what we've sometimes done is doubled up so that we could do twice the number of slots out of business, so we can sort of service more of the staff in one go, which is great because I never used to have Sue, and now I have, so it's a great help to have her along. Trying to do the whole county on one's own is a bit of a challenge, but now we can do things doubly better. So that's me done for a moment on the programs. Does anybody have any questions you want to ask me about any program in particular?
Do you go on to the do you have a set center where people can go to, or do you actually go to the company? Is there a minimum number of people that you will go to?
Right. Okay. We go to the company. We don't have a center as such, although we could work from a community center if it was something that was a benefit to the local community. We definitely could do that. But normally speaking, we get in touch with the health and wellbeing representative, and then we organize a room at one of the, like the colleges, for example. We Sue and myself did Penworth and Truro College the other week, and we had rooms set aside. And you need to have some level of privacy really for confidentiality when you're talking about sort of that person's health and well-being.
Is there a minimum number of people?
Yeah, well, we have a maximum number, probably the easiest way of doing it really, and that is we can do 7 health checks in a day, and we can do 5 VLAs, virtual lifestyle assessments, in a day. Health assessments, we tend to blend the two really, but we could do again 7 to 8 health assessments in a day as well. Taking into account we have to bring quite a lot of equipment with us. That gives us time to arrive, set up, be ready, do the appointments, and then set down, and then the transport element of getting back. With the NHS, of course, we update medical records there. So whatever the findings are with the NHS program, then we send a letter to the practices to update the individual's medical records.
I'm just going to tell you about the training that Healthy Cornwall offers. We have a number of accredited mental health first aid England trainers and accredited suicide first aid and applied suicide intervention skills trainers. And they run the whole offer of mental health first aid courses, from the full 2-day qualification course down to a half-day awareness course. Those courses, the training we deliver free of charge. We just have a small charge for the cost of the actual resources that are used. Anybody that attends one of the courses, they will receive, if, for example, they do the 2-day qualification course, they get a really big, thick booklet. It's absolutely brilliant, to be honest, a really good course. One of our most popular oversubscribed courses, but we're constantly adding new dates and looking for new trainers to help us to deliver those. We have suicide first aid and applied suicide intervention skills training courses. As I'm sure many of you are aware, Cornwall has quite a high suicide rate, and this is training that anybody can book on to attend, and it gives people the knowledge and skills and ability to talk about suicide, for one thing, but to make a direct approach to somebody who they feel may be considering it, and gives them, if they do the applied suicide intervention skills training, that's the assist course, that definitely gives them the confidence, skills and knowledge to be able to bring somebody back from potentially suiciding. Really highly rated course internationally, as not just in Cornwall. Again, we just charge for the cost of the resources, which is, I think, £27 currently. Outside of Cornwall, the mental health first aid course will cost somebody upwards of £300. In Cornwall, it's 27, because we're funded by the Council and Public Health England to be able to do that. And the suicide intervention skills course, again, £27. Outside of Cornwall, it's around about 250. So it's absolute fantastic offer that we're able to provide. But we also do a range of workshops which we deliver free of charge. We run a mental health awareness workshop, which looks at our own mental health and and how we're able to help ourselves. And moving on from that, we also have a trio of workshops which covers understanding stress, developing resilience, and mindfulness, meditation, and sleep hygiene, which covers things that will give you the skills and knowledge to look after your own mental health and the things that can impact it, and how you can basically how you can help yourself stop you getting to a point where perhaps you need a little more intervention. Excuse my voice, I've just had COVID and it keeps going. We also run a menopause awareness workshop, which is a 2-hour workshop, incredibly popular, not just with ladies, but we're getting quite a lot of men going on the workshop as well. It's really vital that everybody understands the impact of menopause, not just women going through it. We actually have one of our male trainers is just starting to deliver that as well, which will be quite interesting and to give a different perspective perhaps. And the other workshops, we have something called Making Every Contact Count, which is all about giving people knowledge and skills to be able to make a very brief intervention with anybody really, with a colleague, with a friend, family, to talk about any aspect of health. And that's about it. I think that's all the training that we have. We have a little brochure that we'll be able to send out as well that covers everything there. I think that's it.
Thank you. Thank you. I mean, actually, it's brilliant to see how much is available, and particularly on that preventative side. And I think we've all noticed, particularly on the mental health side, you know, we're still not over COVID in a couple of ways. You know, I still, you know, we've had this in the hospitality section, but even the way customers have reacted, the national fuse has got a bit shorter, which is, you know, in terms of firing off, which is worrying, because it's actually an indicator of underlying worries. Yes, there are some people, but the fact that people have done it, I think also I was just reflecting what you said about lockdown, is I remember when I was first given a laptop and access to the internet, but way back in the 90s, I did it as a pilot. But it was fascinating really at that stage. I was asked, I had to go and have a chat with people. I had to go home and talk to the wife and kids, because they were very concerned of that losing the sanctuary and work creeping into the home and the tensions that can be, and whether the partner is comfortable with that. And I think, you know, because of COVID, a lot of people were forced into doing that. And your point about, you know, people trying to work, and we had it with some of our staff with home educating, and we actually employ husband and wife, and trying to get the kids done, trying to get their job done, you know, when they're working hard. Massive strain on relationships, you know, and relationships between parents and children, as well as, you know, partners. You know, it's, you know, you wouldn't really have never had that situation where you're all bunged in a box and coping with things. And to a certain degree, well, Monday we're talking about new markets, and one of the ones I'm talking about is, well, I like the word Walladay because I love stupid names, but it's the whole thing of when you look at your working year, if you are working at home a lot, you can actually still take a holiday, even if you have to do the odd meeting online or the odd bit of email. But actually, you probably do need to get away from the four walls, because although everybody hates the commuting and it's good on carbon, the danger is you are in that goldfish bowl and things can get on top of you. I mean, we're lucky enough here that when, you know, going for a walk in Cornwall does actually tend to do that. But if you're in many other places, you haven't got the luxury of being in a big estate in Bristol or Reading, you know. Anyway, I'll go off on one. Probably means I probably need to sign up for a virtual session. Anybody with any questions? Now, as I said, this is going to be recorded. We are going to put it out to over 1,250 business members, but also that literature would be good, especially if there's a PDF, because we can get those out as well and do sessions on them. And
I shall forward those to you, Malcolm.
Brilliant, because we've got to get this message out. And also the fact that, as anybody knows, if you get a key member of staff go ill, you know, talk about strain on everybody else, that the old adage about prevention is far better than cure. And failure is, prevention is better than failure, never so much so than in people's health. because the impact on them, their families, but also on the supervisor and the team members.